Now, has the virus, have we seen the virus cause any kidney problems in the general population, people who don't already have kidney issues?
Yeah, this was one of the really big surprises of this pandemic. Early reports out of China, this is back in February, early March, suggested that 40% of their patients who were hospitalized with COVID-19 developed either proteinuria or hematuria, 40%, and that 20% of those hospitalized had some decrease in their GFR, in their kidney function. So there was a really early signal that was really clear that the kidney was a target for people with no previous kidney disease for acute kidney injury. But we have more recent data that's been generated from this country that suggests that indeed the incidence of acute kidney injury among people with no previous kidney disease when infected with COVID-19, at least if you're sick enough to be in the hospital, is somewhere in the range of about 30%. 1 out of 3 people have evidence of injury to their kidneys if they're infected with this virus.
Okay. Now, most specialties have tested their drugs to see if it has efficacy against COVID-19, especially in gastro and in rheum. Have any nephrology drugs been successful in treating patients with COVID-19?
Well, I'm not aware of any of the standard drugs that we've used that have had a positive effect. The one drug that's worth mentioning are the ACE inhibitors. We commonly use ACE inhibitors to treat hypertension in our patients with chronic kidney disease. And early on, there was real concern about that because the ACE2 receptors that are located in many organs, but including the kidneys, ACE2 receptors are actually the way that the virus gets into cells. That's their vehicle for getting inside a cell. So the concern was, if we're giving ACE inhibitors, might we not be upregulating those receptors and making it much more likely that people will get infected? And so early on, there was concern, maybe we shouldn't be using ACE inhibitors. Well, the data since then has shown no evidence that ACE inhibitors have any bad effect on patients with COVID-19. So as far as drugs, that's the one that's probably most worth mentioning.
Okay. Now, this question is probably more about last spring than it is currently, but do you believe when everything got locked down and really only emergency medical services were ongoing during the spring, do you believe that we missed early diagnosis for a lot of people with kidney failures and kidney diseases?
It's a wonderful question. Here's the anecdote. I can tell you in our practice that in the last 2 or 3 months, we've been deluged with consultations. Loads of people coming into the office now for evaluation of decreased kidney function or kidney disease or abnormal urine and protein, et cetera. And the volume we've seen recently in the last 2 months or so suggests to me that lots of it was delayed. Lots of it was because early on, people were sheltering at home and were not coming in. Now, we've been using telemedicine, which has been absolutely fabulous, I think, to do our follow-ups when we can, when it's safe, and to see new patients even when it's been safe. And telemedicine is a great tool. I think we've learned how to use it, starting to learn how to use it well. But in kidney disease, we often, really, it's important to do examinations and to see people eye to eye and to make sure there are none of the manifestations of end-stage kidney disease present. So I suspect that there was delay in screening. We're seeing some evidence of it now. But I think the lessons it's taught us is how we should think about using telemedicine more effectively than we have before.